Hey there, and a super warm welcome to the MediByte channel. I'm so glad you're joining us today. As healthcare professionals, we truly believe that understanding your own anatomy and the conditions that can affect it is just incredibly empowering. So today, we're going to provide a complete, detailed, and really easy to understand clinical overview of two very specific gynecological conditions, cervical stenosis and uterine adenomyosis. We're going to break down the science and bring absolute clarity to what is actually happening inside the body.
Here at MediByte, our whole mission is to be your guide to clinical clarity. Today, we're diving into the often misunderstood world of unexplained pelvic pain and menstrual abnormalities. These are symptoms that so many people experience, but trying to find the root cause, well, it can sometimes feel like trying to solve a giant puzzle. So, let's dive right into this and decode the clinical data together in today's explainer.
All right, here's our clinical roadmap for today. First, understanding cervical stenosis. Second, causes and complications. Third, symptoms and diagnosis. Fourth, a related condition called uterine adenomyosis. And finally, treatments and takeaways.
Part 1. Understanding cervical stenosis. Okay, to really grasp this, we first need to pinpoint the cervix. It's the lower part of the uterus, and it basically acts as a vital gateway to the vagina. So what happens when this gateway malfunctions? Well, by definition, cervical stenosis is the narrowing or complete closing of this exact passageway. It's super important to understand that this is fundamentally a mechanical, physical blockage issue. The literal tunnel from the vagina to the main body of the uterus just becomes restricted.
Mechanically speaking, the difference is like night and day. A normal, healthy cervix features an open passageway. It naturally allows fluids to exit and sperm to enter. But a stenotic cervix? It's tightly narrowed or even completely sealed shut, which drastically restricts any flow going in or coming out.
Part 2. Causes and complications. So why on earth does this happen?
Well, tissues don't usually just close up on their own without a reason, right? Cervical stenosis is almost always a domino effect from a distinct disorder or a previous medical procedure. A very common natural trigger is menopause, simply because the tissues in the cervix thin out and atrophy as hormones change. But it can also be triggered by cancer of the cervix or the endometrial lining. Moving over to procedural causes, medical interventions are a massive factor here. For instance, surgery to treat precancerous changes, which we call dysplasia, or an endometrial ablation done for persistent bleeding. And finally, radiation therapy used to treat cancers in this pelvic area can also cause that passageway to close up.
Now, because the passageway is physically blocked, complications can arise, though thankfully they are pretty rare. One is hemotemetra, which is an accumulation of blood getting trapped in the uterus. Another one, particularly if the root cause of the stenosis is cancer, is pyometra, which is an accumulation of pus. Plus, in women who are still menstruating, this absolute blockage means menstrual blood and cells can actually flow backward through the fallopian tubes and into the pelvis. This retrograde flow is a big deal because it can possibly cause a condition known as endometriosis.
Part 3. Symptoms and diagnosis. Let's talk about what the patient actually experiences.
Before we go listing off any warning signs, there is an absolutely crucial point you need to know. Cervical stenosis very often causes literally zero symptoms whatsoever. None. Many women go about their entire lives completely unaware of it, suffering absolutely no negative day-to-day effects from this narrowing.
However, if you are premenopausal, meaning you're still menstruating, that blockage can definitely cause issues. Symptoms to really look out for include amenorrhea, meaning your periods just stop, or dysmenorrhea, which translates to incredibly painful periods, as well as abnormal bleeding. Rarely, it can even cause infertility, and that's simply because sperm physically cannot pass through that closed cervix to fertilize an egg. Furthermore, if complications like that trapped blood or pus we just talked about develop, a woman might feel severe pain, notice her uterus is bulging, or even feel a distinct physical lump in the pelvic area.
So if a patient comes in with these symptoms, here is the clinical diagnostic journey. It always begins with a standard pelvic exam. The doctor might suspect this diagnosis if periods have completely stopped or become super painful, especially after a previous cervical surgery. Step 2 is the actual confirmation. The doctor will literally try to pass a small probe through the cervix and into the uterus. If they can't do it, boom, the physical blockage is confirmed. Step 3 then involves tests like a pap smear, an HPV test, or an endometrial biopsy just to safely rule out cancer, especially if abnormal bleeding is part of the picture.
Now, at this point in our explainer, you might be thinking about other things that cause painful periods or an enlarged, bulging uterus.
It's a great question, so let's pivot and see how this builds into our next topic. What about uterine adenomyosis?
Part 4. Related, uterine adenomyosis.
So while cervical stenosis blocks the exit door, uterine adenomyosis actually affects the very walls of the uterus itself. It happens when tissue from the glands in the lining of the uterus, the endometrium, takes a wrong turn and grows directly into the muscular wall of the uterus. Because of this intrusive tissue growth, the entire uterus becomes enlarged. We're talking sometimes doubling or even tripling in size. Interestingly enough, medical science still doesn't know the exact cause of this condition, and it's definitely worth noting that some women with adenomyosis also suffer from endometriosis or fibroids at the same time.
As you can imagine, this heavier, enlarged organ creates a real burden. Patients often experience remarkably heavy and painful periods that can literally lead to anemia, usually coupled with this vague, lingering pain in the pelvic area. And because the uterus is physically taking up more space, it creates a really uncomfortable pressure on the bladder and rectum. Sometimes sexual activity can become painful too. The one comforting fact here, though, is that these symptoms usually disappear or at least significantly lessen after menopause hits.
Diagnosing this one is notoriously tricky. A doctor might suspect it during a pelvic exam if the uterus feels enlarged, round, and noticeably softer than normal. They'll almost always follow up with a transvaginal ultrasound or an MRI to support their suspicion. But here is the truly fascinating part. A definitively proven diagnosis requires examining the tissues under a microscope, and the only way to actually obtain those tissues, completely removing the uterus through a hysterectomy. Crazy, right?
Part 5. Treatments and takeaways. Let's explore the clinical solutions.
Looking at the treatment plan for cervical stenosis, you'll see it entirely depends on the patient's experience. Emphasizing this once again, if you are asymptomatic, absolutely no treatment is needed. You're good to go. For symptomatic women, the opening can be widened or dilated by inserting small, lubricated metal rods, progressively increasing their size. If the cervix is stubborn and keeps closing, doctors might place a tube called a cervical stent right in the passageway for 4 to 6 weeks just to force it to stay open.
By comparison, the adenomyosis treatment plan usually starts with just managing the symptoms. An IUD that releases a synthetic female hormone called levonorgestrel can be a real game changer for controlling bleeding and pain. Doctors might also suggest oral birth control pills, though honestly, these are often a bit less effective. Everyday analgesics can be taken for pain management. Ultimately, if the symptoms are severe and just completely debilitating, a hysterectomy is performed. It is the only treatment that completely and permanently cures the symptoms of adenomyosis.
As we bring this clinical explainer to a close, I really want to leave you with this highly reassuring quote straight from the clinical data regarding cervical stenosis. If cervical stenosis does not cause symptoms, no treatment is needed. It's such a powerful reminder that our bodies often undergo structural changes that don't necessarily require medical intervention unless they are actively causing us harm or discomfort.
You know, understanding our anatomy empowers us to know exactly what is normal and exactly when to seek help. If your body is capable of hiding these wild structural changes in plain sight without you even knowing, it makes you wonder, what other anatomical mysteries might be quietly shaping your daily life? If you found this explainer helpful today, please hit that like button, share this clinical clarity with someone who might need it, and absolutely subscribe to the MediByte channel for more empowering health insights. Stay curious and stay healthy out there.